Well, hey guys, in today's video, I wanted to comment on this new act that went into place in the UK, the Botulinum Toxin and Cosmetic Fillers (Children) Act, basically banning fillers, Botox, any kind of injectable in children under the age of 18. So according to the Minister for Mental Health, Suicide Prevention and Patient Safety, Nadine Dorries, said the move was to protect children from pressure to achieve truly unrealistic body images. This is interesting. There has been a huge rise in people of all age groups seeking out cosmetic procedures, including filler and Botox. Social media is often to blame, seeing unrealistic images of influencers, celebrities, many of whom have had these procedures, many of whom are very open about getting these procedures, document them, and it creates this desire to have those procedures and to look that way. But is it realistic, and is it potentially harmful, especially when we're talking about young, impressionable children? Tens of thousands of teens have undergone some sort of treatment to smooth or plump their features. So starting on October 1st, it will be illegal for certified injectors to inject someone under the age of 18 with a muscle paralyzer, aka like Botox, neurotoxins, which remember paralyze the muscles to smooth out wrinkles that appear with movement. It'll also be illegal for them to do filler. You know, it's unsettling that so many teens and young people are seeking out this procedure. And the thing about cosmetic procedures is there are physicians who do these procedures, and there are a lot of these like certified injectors. And so it's kind of almost a wild west in a sense. And if you really want the procedure, you'll find somebody who will do it. And so it's nice to see that there's some regulation in place to protect minors who, you know, are very vulnerable. Now, this law, of course, doesn't completely ban people getting these injections for medical reasons. There are a lot of medical reasons for which somebody might need Botox or filler. For example, Botox is used to treat migraines, so physicians will still be able to do that. Botox is also used to treat something called torticollis. I mean, it has a lot of benefits for a variety of medical conditions. So physicians will still be able to do neurotoxin injections or filler injections in somebody 18 years of age or under for medical necessity. So that's, as with any procedure in medicine, that would entail having a discussion though of, you know, treatment options, weighing the risks versus benefits, and it's not gonna be for cosmetic reasons in those cases. But certified injectors are not physicians. They're people who, you know, maybe took a weekend course on how to do this. And because cosmetics, you know, it's not medicine, it's not something that is covered by insurance or your health plans in other countries. It's something that you pay out of pocket for. And it's a bit of a wild west in terms of the landscape and regulation. So I think people 18 years of age and younger, I do think they are a vulnerable population, given everything that we see on social media, for potentially developing poor self-esteem from this. I mean, it's well established that social media is making teens more depressed, sad, poor self-esteem, and there is a rise in what's called body dysmorphia. And it's thought, you know, that social media plays a big role in this, and young people are really vulnerable to these kinds of images. I talked about this in another video that I did earlier this year, and you guys really seem to enjoy that. Maybe it's something that some of you have struggled with. I mean, it's difficult to go on social media and not feel like, my goodness, my forehead doesn't look like that. My skin doesn't look like that. I have this blemish, I have that blemish. What you see on social media does not reflect reality. Everything is highly edited. They use these filters, which I don't care that they're using them, but I think if you're young, you may think that, wow, look how great their skin looks. What are they using to get that appearance of their skin? How do I get that? And maybe they're open about getting fillers and things like that. You don't realize that they're also using this filter. So I do think, you know, young people are really, really impressionable. Now, to be clear, Botox and fillers, they are not FDA approved for children for cosmetic reasons. So Botox is FDA approved for people 18 years of age and older, and filler is approved for people 21 years of age and older. Aesthetic medicine has always been this gray area where you have, you know, kind of butting heads with conflict of interest. It's a profit-mediated aspect. There's no doubt. I mean, you're paying out of pocket for aesthetic treatments, but it's also something that benefits patients from an emotional standpoint. And you know, it's a very rewarding practice to do aesthetic medicine. But here's the thing, physicians and healthcare providers, they're held to a standard. And so if you are under the age of 18 and you go to a physician, for example, and request this, they're likely not going to do it. Of course, there are always going to be cowboys out there, as they call them, who, you know, may be willing to, and filler is only FDA approved for people 21 years of age and older. So while you have the legal ability to consent to filler at the age of 18, a physician who administered filler, you know, gave you filler at that age, would technically be doing it off-label. So it's a slippery slope for both the patient and the provider, honestly. When it comes to just the overall landscape of aesthetic medicine, it is kind of, you know, a bit of an unregulated territory in some aspects, and that you have people who go to school and become either plastic surgeons or dermatologists who undergo a lot of training. They do special fellowships in aesthetic medicine, highly trained. And then you have people who take, you know, like a 1 or 2 week course and are inexperienced. So the fact that a younger person could just walk in and to like a med spa or something like that and have these procedures, they could potentially not only have, you know, long-term damage to their emotional well-being from, you know, getting into this too early, but then poor technique, they could be scarred. I mean, there are a lot of potential serious adverse effects, some of them temporary, that are more likely if you go to someone who is inexperienced or just doesn't have that training. Overall, filler is a very safe thing to do, but there are risks and there are potential complications that you could encounter when going to someone, especially who is not experienced. And the fact that a young child might have access to this, it is concerning. You can, you know, for example, some adverse effects of injectables include infection, scarring, and blindness when done around the eye area. And while neurotoxins like BOTOX also are super safe and very low risks of complications, you can develop complications, temporary facial droop. That's very unsettling, droopy eyebrows. I do think we have to seriously take a step back and consider the fact that we don't know what the long-term implications of getting injectables too young are. Obviously, the overarching concern, I think, with this law is that there are potentially long-term emotional effects, body dysmorphia, poor self-esteem, etc. But truthfully, we do not know how this might impact how the face ages long-term. It could, you know, potentially have effects. Getting Botox too young, too many injections, could you potentially cause some muscular atrophy that would cause undesirable cosmetic outcomes long-term? That's not going to be obvious right away. So after October 1st, businesses are going to have to verify patient age in the UK. I think that is a good thing. Failure to do so will involve persecution. Of course, where there is a medical need, a doctor will still be able to approve treatment. But this must be administered by a doctor, nurse, dentist, or pharmacist. I mean, if you think about it, we also regulate minors' access to other injectables, if you will. You can't get a tattoo under the age of 18. You should not be able to access a tanning bed. That legislation, there's been push for that kind of legislation in the US to protect minors from skin cancer, which if you go on a tanning bed, you're almost, you know, it elevates your risk dramatically for skin cancer, including the deadly melanoma. And there is a lot of push here in the States for more legislation to restrict minors' access to tanning beds. Unfortunately, some of it has kind of gone on the back burner as far as the push towards more legislation since the pandemic. It's interesting, they refer to the increased popularity of injectables as the Love Island surge.
Hi, I'm Liberty. I've just left the villa and I'm ready to answer all of your questions.
I've never watched Love Island. Is that a show? It's obviously a reality show, but is that something only in the UK? Let me know in the comments. Do you guys watch that? I thought Love Island was somewhere people were going to have like black market cosmetic procedures. And anyways, the Love Island surge, after learning that more than 41,000 procedures were done on underage patients in the last year, the BOTOX and cosmetic fillers, the botulinum toxin and cosmetic fillers (parentheses Children Act) went into effect. Let me know in the comments, what do you think about minors having access to aesthetic procedures? I personally think it can go down a dark path, set the person up for long-term negative effects on their emotional health. You know, Instagram, they're always changing around their algorithms and doing all these tweaks and adding all these silly stickers and things that they want us to tap on and play with and all this stuff. It would be really interesting if they did away with filters for a year, the filter-free year. In my opinion, I think everyone benefits from restricting the amount of time they spend engaging with social media. You can just binge on social media, and these apps, algorithms, platforms, they are designed to keep you in there. I mean, especially TikTok and Instagram, they do not want you leaving the platform. They don't. And so you have to restrict the amount of time you spend on there, not only for your emotional health, but you have your life to live. You can't just be engaged in these platforms nonstop. But a lot of people do end up getting sucked into their phone, and it leaves them feeling emotionally drained, feeling horrible about themselves, because they're seeing all these images of people with all this stuff. And I recommend reading books, but seriously, read some more books. Even if you hate reading, you have to ask yourself, do you hate reading more than you hate like feeling like you're disgusting pile of nothingness, which social media can make you feel like that? So read a book, honestly. It's entertaining. It will help you sleep better, to not be staring at your phone in the evening time. All that blue light is keeping you up, which causes more stress, more anxiety. Let me know your thoughts about this in the comments, you guys. I'm interested to hear what you guys think. I hope you all enjoyed this video. If so, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.